Hi guys, this is Jason Williams DO. This is the Williams Family Medicine channel helping you to live your best life. Today I wanted to visit with you about the connections between metabolic health disease and mental health disorders. To begin with, I am not a psychiatrist. I am a family physician. A lot of my patients that I see in the office have mental health disorders, so I'm very familiar with them. At the outset of this video, I want to make it clear that I'm not trying to downplay mental health disorders in any way. I'm just trying to approach them in a manner of assessing the root cause and treating the root cause with hopes to improve the condition. I have read papers, watched podcasts, and watched YouTube videos from other specialists in this area. One particular physician that I have followed is Chris Palmer, MD. He is a Harvard psychiatrist. He himself struggled with metabolic syndrome as a medical student. He discovered the power of fixing his health through nutrition and noticed his mental health disorder, as well as many other health problems, improved when he implemented this for himself. Over time, he started implementing ketogenic diet with his patients and noticed very dramatic improvements in some particular patients. He does report that this does not help everyone, but for some, causes them to have remission of their mental health disorder and also de-escalation of medications. Dr. Palmer seems to think that mitochondrial dysfunction may be at the root of some of these problems, as mitochondria are the powerhouse of your cell, the energy producers of your cells. In metabolic health disorders such as diabetes, metabolic syndrome, obesity, etc., mitochondria are damaged and don't work very well. If you're interested, please check out Chris Palmer, MD. Today, I wanted to send a message to my patients about trying not to be a lone ranger, trying to avoid social isolation and loneliness. This problem has probably ramped up significantly with COVID-19, work from home, quarantine, all of these issues. Thankfully, some of these restrictions are being lifted. However, there are still plenty of people that are working remotely and don't have as much social connection and interactions with other people. Sometimes our new norm is not healthy. As a doctor, I'm interested in the underlying connections. Some of you may not be, but I'll briefly go over some of the physiology that is at play. Social disconnection and loneliness leads to an increased activation of the hypothalamic-pituitary-adrenal axis. The hypothalamus is part of the brain that stimulates the pituitary gland that releases hormones that regulate many other aspects of metabolism, including the adrenal glands. The adrenal glands sit on top of your kidneys. If this axis is stimulated, then corticotropin-releasing hormone increases. This stimulates the pituitary gland to produce a hormone called ACTH, which in turn stimulates the adrenal glands to increase production of glucocorticoids, which results in increased cortisol levels. I've spoken about cortisol levels previously in other videos. Cortisol is your fight or flight hormone, and it should go up in response to an acute stress. However, that should be a short-lived occurrence, and then it should go back down to its resting state. People that have persistent high cortisol levels have many metabolic derangements. Cortisol has been shown to directly damage mitochondria, these organelles in your cell that produce energy. Mitochondrial dysfunction has been linked to depressive disorder, bipolar disorder, substance abuse, and even schizophrenia. It's interesting how things are interconnected. If you happen to be someone that has metabolic syndrome or chronically elevated blood sugar, then you also have mitochondrial dysfunction and damage. As we mentioned before, increased cortisol levels cause metabolic derangements. Unfortunately, they increase insulin. As the insulin stays up, your risk for prediabetes, diabetes, and fatty liver disease markedly increase. Most people that have high levels of cortisol also become obese. Loneliness and social disconnection also affect another hormone in your body called oxytocin. Oxytocin functions both as a neurotransmitter and a hormone. It is released from the hypothalamus when you have positive social interactions, for example. Proper oxytocin release inhibits this hypothalamus-pituitary-adrenal axis. However, when oxytocin levels are low, then the result is increasing cortisol levels. Oxytocin has been shown to decrease inflammation and oxidation. If your oxytocin levels are low, then you can see the increase for chronic diseases such as heart and neurodegenerative diseases. Unfortunately, loneliness and social disconnection create a vicious cycle. Being lonely and isolated actually begets being more lonely and isolated in many cases. If you're already disconnected, it is hard for you to interact with others. You have less confidence in interactions, and you will not be drawn to other more positive people. You can break this cycle by first identifying that you have a problem, and when you do, then starting to write about the problem. Journaling sometimes can be helpful for you to put your emotions on paper to try to understand what's going on in your mind and body. If you see a mental health specialist, they have cognitive behavioral techniques and tools for you to use to help decrease stress and emotional overload that can help you to participate in social events or interactions. With regards to oxytocin, if you cohabitate with others, if you have massages, if you have pets, if you have sex, oxytocin levels increase in all these cases. Practicing your faith in a community of like-minded believers also has a similar effect. I have read studies that show that lifespan of people that are active in practicing their faith is 7 years longer than those that do not. Exercise, yoga, stretching, these type of activities all leverage your oxytocin and increase this. They also improve endocannabinoid release and improve other neurotransmitter release, such as dopamine. Avoiding high glucose or fructose environment can improve mitochondrial function. If the mitochondria are working better, then you'll have more energy delivered to the cell, and that includes brain cells that are implicated when we talk about some of these mental health disorders that we mentioned earlier. In another video, I have discussed the endocannabinoid system. This system seems to play a role in synaptic plasticity, which is basically how your nerves adapt to changing situations. The endocannabinoid system has been directly linked to neurotransmitter releases, such as dopamine that we discussed earlier. It also seems to have anti-inflammatory effects. For more details on this system, please see my other video about endocannabinoids. In that particular video, I discuss that poorly functioning endocannabinoid systems result in mitochondrial dysfunction also. What we are trying to accomplish is decreasing stress, decreasing isolation, decreasing loneliness. Please note there are many problems that have been directly linked to stress and social disconnection and loneliness. Please note that these are also interconnected with other mental health disorders. I'm going to read from a list of a few of these conditions, and you will probably notice how prevalent these conditions are. Asthma, eczema, hives, rheumatoid arthritis, ulcerative colitis, headaches, chronic abdominal pain, pelvic pain, low back pain, irritable bowel syndrome, peptic ulcer disease, diabetes, hyperlipidemia, obesity, heart disease, osteoporosis, and then anxiety, depression, cognitive dysfunction, and insomnia. I'm always interested in the root cause of health conditions. Instead of putting a Band-Aid on a disorder such as depression, such as just using an antidepressant only and not addressing other factors, I think is incorrect. Now, it is common to have to use antidepressive medications. My intention when I start patients on these medications is find the cause, treat the symptoms if necessary. Maybe that will only be a short while, but in the process, try to find the root cause of the disorder. This is challenging, and I'm not always able to find the root cause. Some of the time I can, though. Once we find the root cause, it's up to the patient being empowered with information to make changes. Once again, if you review Chris Palmer, MD's videos or podcasts, you'll see that he has had great successes in treating patients with very serious psychiatric disorders. I think this is very important information, and I always try to seek a root cause for my patients. I know it can be very challenging and be time-consuming, but I'm hopeful that it is worth it. If you happen to have a tendency to be isolated, feel like you're lonely and not connected to others, I don't want you to continue that way. It's very important for you to get out of this rut. This video explains some of the reasons this happens. Much of the content of this video was inspired when I read a review article titled "The Interplay Between Loneliness, Metabolic Illness, and Mental Health." This was published in Frontiers of Psychiatry in 2023. This article seems to embody a lot of the things I try to implement in my practice. If you are my patient, I hope you found this information useful. If you're not my patient, please see your own physician to discuss your diagnosis and treatment. This is Jason Williams, DO. This is the Williams Family Medicine Channel, helping you to live your best life.